welcome to Pathophysiology. In this first chapter, we're going to discuss an introduction to disease. So there's a lot of vocabulary in this chapter, some basics just to lay the foundation for future chapters when we discuss various diseases and disease processes associated with the various body systems. So let's begin. First, let's talk about health. What is health? So health is basically a state of being free from disease, injury, or illness. So we all kind of understand what it is to be healthy. Then there's this concept of homeostasis. And homeostasis basically means maintaining a relatively stable internal environment while external conditions change. And you've learned about this in anatomy and physiology and medical terminology, and that's basically the way the body maintains balance. So, for example, sweating to lower your body temperature when you exercise. So as your body temperature heats up, you sweat in order to cool down your body temperature to maintain that normal environment. Disease is any deviation from the normal structure or function in the body that will interrupt or modify the performance of your vital functions. So it's an abnormal state that the body enters. Pathology is the study of disease, and this can include the mechanisms, the signs and symptoms, the treatment, and the prevention of disease. And then a pathologist, remember from medical terminology, is somebody who specializes in the study of diseases. Signs and symptoms, these always go together, right? So you've heard of signs and symptoms before. So signs are evidence of disease that can be observed. So anything that you can see, like an elevated heart rate or an increased temperature. So think about like a street sign. You can see and read a street sign. So signs are evidence of a disease that you can see. A symptom, symptoms are indications of a disease that the patient tells you. They're reported by the patient. So something that you can't necessarily see. So something like pain, a headache, dizziness, or itching, those are things that the patient will tell you, but you can't actually see. So those are symptoms. Syndrome and disorder, those two are a little bit trickier to understand. Syndrome is a group of signs or symptoms that usually occur together. So it's like a collection of signs and symptoms that always occur together. So AIDS, acquired immunodeficiency syndrome, irritable bowel syndrome, Down syndrome, those are collections of signs and symptoms that occur together. So they're a whole collection of symptoms and signs that go together to form this whole collection of symptoms. A disorder is a functional abnormality. It's not necessarily linked to one specific cause or physical abnormality, but it can indicate a specific disease or even not so specific disease. So something like a heart arrhythmia, for example, that's a disorder, but it can be caused by a number of different things. Disorders are used a lot in mental health and behavioral disorders like attention deficit hyperactivity disorder, ADHD, and other behavioral disorders. The term diagnosis is the process of identifying a disease or a disorder. You may hear the term differential diagnosis. That's the process of weighing the probability of one disease against other diseases that account for a patient's illness. For example, if somebody has a runny nose, what we call rhinitis, they may have allergies, they may have hay fever, they may have a cold, and the process of determining what the actual cause of the runny nose is the differential diagnosis. So a diagnosis is just that process of identifying a disease or a disorder. And then physical exam, that's how we gather all our information, right? So it includes a number of procedures. And the list there is kind of the things that we do as healthcare providers as part of the physical exam. So the first thing we do is inspection, right? We look. Inspection is just looking. So we look for abnormalities, we look for deformities, we look for rashes, anything that we can see, that's part of inspection. Palpation involves feeling. We actually feel with our hands. We're looking for any tenderness, any pain. We palpate pulses. That assesses circulation. We look for warmth or coolness. We can tell circulation. We can press on the fingertips, the nail beds to see if circulation returns. Again, we can look for distal pulses. If there's any tenderness when we press on something, We can palpate the abdomen, limbs, anything like that. Palpation is just feeling. Auscultation is listening. So we listen with a stethoscope. We can listen to heart sounds. We can listen to lung sounds. We can listen to abdominal sounds. We can also listen to large blood vessels like the carotid arteries in the lungs. We can listen for abnormal sounds called bruits. We can listen for murmurs in the heart. We can listen for wheezes or rhonchi or rales in the lungs. We can listen for borborygmi. You probably learned that in medical terminology. The abnormal, or I shouldn't say abnormal, the rumbling sounds in the intestines, if they're very fast or they're very slow. And then percussion, this one's a little trickier. This is when you actually tap on the abdomen and you're looking for hollow versus solid organs, and you can actually tell the difference. It sounds a little bit different, hollow versus solid organs, and you can tell the border of the organs. You can also tell the difference between fluid and a hollow space. It's a technique that takes a lot of practice. So it's a technique that takes some tuning, if you will. It takes a lot of practice. It's not for the novice or student. It takes some expertise to do very well. And then vital signs we will assess with every physical exam. Temperature, pulse, respiration, blood pressure, and also pain is said to be the fifth vital sign. So we'll assess a patient's pain on a 1 to 10 scale to find out how severe their pain is. Laboratory test is an important part of diagnosis because that gives us information about what's going on with various fluids and tissues in the body. So urine, blood, sputum, stool samples, and then tissue samples taken from, for example, a biopsy or surgical procedure can give us information about what's going on in the patient's body. And then imaging technology. So imaging studies include things like electrocardiography, EKGs or ECGs, radiography tests, x-rays basically, CT scans, MRIs, ultrasounds, which uses sound waves, and nuclear medicine scans all give us information about the patient and help us determine a diagnosis.